Welcome to Health 4.0 Leadership Podcast. My name is Namrata Bagaria and I'm your host. My guest today is Karim Delgado. Welcome, Karim.
Thank you.
And Karim is the CEO and Head of Product R&D at Brain Mechanics, which is based in Calgary. So Karim, as you know, this podcast is aimed to create a Health 4.0 Leadership Institute, which basically is for creating capacity building to understand what Health 4.0 is and how is it different or same to Industry 4.0. So can you explain to our listeners, where are you contributing in the present health ecosystem, in what capacity, and what are your top 3 mandates?
So we have 2 areas that we're really focusing on. About 6 years ago, my father passed away from Alzheimer's, and I kind of made it my mission in life, found my life purpose around that mission. And so we're really focusing on trying to find a solution for Alzheimer's. And on this journey on trying to find a solution to Alzheimer's, we realized that we needed to do quite a lot of innovation on capturing data sets on people, technologies, health technologies that could help us, enable us to actually capture big data of the body, right? Mm-hmm. Taking a systems biology approach of, proteomics, metabolomics, genomics, macrobiomics, and trying to capture a big picture of the body from the biometrics and biomarkers, right? So things like taking, lab tests and run it through AI tool to then like a blood sample, like, $60 blood sample, you can run it through AI tool and get about $2,500 worth of data, right? So, try to innovate in a way that we could take standard things and make them better to really start, projecting a big picture of quantification of the body. We've had to innovate quite a lot on the biometrics. So things like, we could literally now are able to quantify an Alzheimer's patient's brain functions faster and cheaper than pretty much anyone else. So replacing an fMRI, so things like this, right? And we really are trying to innovate on trying to find a solution to treat Alzheimer's at scale. So we really have to be pretty crafty on how we actually use technology. And so we've in essence, we've started a foundation called Brain Mechanics Foundation, where we're building the foundation of open source health. We feel like, these innovations, we want to not only build ourselves to help Alzheimer's patients, but to help the world. So we're building open source blueprints, if you will, recipes. They all might not be open source, but we're sharing the entire blueprint. That might have something that might be proprietary, but if you add that into an open source software, or you have a design for like an EEG, for example, or something else like that, then we share those recipes, right? And we're doing that with technology as well as we're doing it with actual therapies. So on the technology side, we're working on a technology called XAI, Explainable AI. And we've literally built last year, we built an explainable AI that explains its findings using natural language. And we're making that open source. We're also working on the Alzheimer's resolution, which is a medical protocol to stop and reverse cognitive decline of Alzheimer's. And, that's pretty rich. I mean, that one has functional medicine, it has cognitive behavioral therapy, bioenergetic medicine, we're adding in nanopharmaceuticals, molecular activated drug therapies, and even cell therapy. So we're kind of coming together to try to get this, solve the problem at the root cause, and then building an entire health technology infrastructure to be able to then treat at scale. So we could actually help, we have a concept called Brain Mechanic, where a person could be, help their loved one, with Alzheimer's at the edge. So they don't necessarily have to be, they're more like technicians. They don't necessarily have to be the experts. The experts would be on the cloud. So we've really built this platform, and we're going to be making it available open source to the world.
Awesome. So this is almost like convergence of technology, and you're making the blueprint for digital twins of a human being. And we had a little chat before this, almost like the research that I do at University of Ottawa, which is so exciting to find like-minded people who believe in open source systems. So Karim, tell me, this is not easy. I know that from my personal experience. So what were your challenges? What were your learnings? And what were your top 3 takeaways from your journey so far?
You know what? The challenges was just really letting go. Just letting go of ego, letting go of these things, just let go and just kind of get in the flow of just trusting the universe to take it to where I need to go, right? So in order for that to happen, a part of me has to die, right? Like identity of who I am has to pass away and then has to be emptied out, right? So, the challenge is constantly trying to do that on a daily basis. And it's so wonderful when you let go, just there's so much abundance because it's not you, it's just flow that flows through you. And I would say that was initially the hardest part is not hard anymore. I mean, it's just, it just flow and things just kind of manifest, but for me, my background is on product management on the R&D side, right? I am a health coach and, I am certified in different functional medicine protocols like RECODE, for example, that's able to stop and reverse cognitive decline using functional medicine, and others, heart math and other different techniques, and, been a meditator. But at the end of the day, it was interesting because, I realized that, I'm no one, right? But if I open up my heart and then start connecting with others and sharing the story, then, we've literally now started from myself to 3 people to now we're in 6 different countries, and 9 different labs and different centers around the world that are all collaborating, and we're all kind of opening up and working together. So yeah, that's kind of some of the challenges that we face. But I'm sorry, what were your other questions? I didn't take any notes.
No problem. The challenge is like, what were the challenges, and then what did you learn from them? So what would be your top 3 learnings? The first is letting go and going
Yeah,
with that flow.
absolutely letting go. Number 2 is, you can't do it all yourself, right? So you have to collaborate with people. And number 3 is that you have to think different. Like the model that we have right now, my father was a physician, my brother's a physician, my sister's a nurse. So I come from a medical background, and I'm not knocking traditional medicine. I think it's wonderful. Like, my father became a physician because it was his volition to help people. He was a really good man. He started orphanages and helped out. He was a gastroenterologist for many, many years. And he wanted to help people, and that was his volition. And then medicine turned into a volumes business and a billing system. And now doctors, unfortunately, is not such an enjoyable experience. And so I realized that the medical field right now is severely challenged because it's having this volume imposed on them. My dad used to say, a patient's going to tell you what's wrong with them. He's got to have a conversation. You would walk and meet the patient in the waiting room, and we would talk at his desk, and then he would do a procedure afterwards. Gastroenterologist, not the most pleasant thing in the world, right? But he tried to establish a repertoire with them and talk to them as human beings, right? Having a conversation. And, he saw that things were deteriorating at a point where now he couldn't, he was kind of forced to stop doing that, and he decided not to do that. But right now, doctors, on average, it's about 6 minutes per visit. They're trying to bring that down to 4 minutes. And they're having issues with lady doctors, but because they want to talk to patients. They take 8 minutes per patient, like crazy, right? Talking to people. So I think the challenge is now, how do we then, you're not going to be able to change that, right? Because it is a system, it is a volume. But I do think that, having things like Healthcare 4.0 and be able to start augmenting, information, and the doctor feeding it with big data of the body where they go away, can capture big samples of what's going on with a patient, so that you don't necessarily, if you're cutting out the health history and cutting out the visitation, at least you have information that can help you, make informed decisions. That's why I think our XAI technology is so important, because it can go deep, wide, and reinforcement learning, but it can also explain itself using natural language and tap into the world's biomedical library to help at least a doctor understand that, this patient has 75% probability, and this is why the AI thinks that it does. It's not like a black box like currently. It'll tell you 75%, and we think like it's because of X, Y, and Z. And then he can make informed decisions, right?
Yes.
Yeah.
Yeah, this is very fascinating. I mean, you touched upon a couple of things which I personally think are very important too. For example, the concept of letting go and collaborating, which talks a lot about soft skills. And one of my other initiatives, which you know about, is Namology. And this was the concept, was to create the leadership for digital transformation. Because when you're going to work with different people who come from different trainings, different cultures, different expectations of what health is and what they can do. Like for me, I've been in this field for 10 years, and I have seen the reason it fails is not technology, it's human beings. So that's one learning. And the second thing which you mentioned was very interesting, is explainable AI. I mean, I had a conversation last year with somebody from the space agencies, And they were like, we need AI because when you have astronauts in space and you're monitoring their health and they're for a long time in space, we cannot have a black box approach, especially with the manned mission to Mars. And now,
Mm.
even with the COVID that's out there, the government of Ontario is building a database, health record database. But it's not just the databases which will solve the problem. You need to know what exactly you want to solve first, and then have the data come in accordingly. So I think these are great challenges of trust and of leadership that you've pointed out. And then this comes to my next question, which is sort of naturally weaving in how, what is your vision of health 4.0? Like, what do you think are the
Uh,
opportunities,
yeah,
and
I
what do
think
you,
that.
okay,
Yeah,
yeah.
sorry, go ahead.
No, I was going to say, what do you think are the opportunities and the technologies that can get that together? So,
Yeah, I think we need to reimagine. Like, I think, for me, I'm not a medical doctor, and it's a blessing. I am a meta researcher, so I do research on research, and I'm a systems thinking guy. So to me, these are Lego pieces. I might talk to Dr. Shopmel, for example, and say, Doc, what's the KPI that we have to look at? And then
yeah,
I'm a biohacker, and I look to ways of actually quantify it faster and cheaper, right? But I think in order for the vision of healthcare 4.0, what I've learned in brain mechanics and why we've been able to do such fantastic work and just really innovate really quickly is that you really need to have not just doctors, but you need technologists. You need an interdisciplinary team, and
yes,
and really working out like this whole idea of like having something, an innovation, and then waiting 17 years to get it out there. Like, that's silly. Like, there's no
yeah,
reason why it should be that way. Like, the way we've been doing it, we have an alpha team, and we do a lot of rapid prototyping. So, literally I could take a device manufacturer, send me a device, and I can capture data points in a matter of 6 weeks, right? And I can really hit it up and understand in an agile way to where the waypoint is to then do maybe a deeper study, right? So we do quite a lot of feasibility, accelerated feasibility lab around that. And then we then take it and we say, how can we then take that thing that's been validated and integrate it into a product or a service that we could actually provide? And then once we have that on an actual proof of concept, and we actually deploy it on a clinic. So we've got clinics where we work on in Colorado, where we have autistic kids. We have clinics in Bogota, Colombia, with the Cell Institute there, where we have really, really deep cellular therapies, and we're all collaborating. And it's really all about having the interdisciplinary teams and then just supporting it and just going. When you talk about COVID-19 and the issues there, that's what's required. Like, I don't understand, like, how can I mean, look, I guarantee you, if we had like $1 million and you and I and others got together and we say, how can we actually start hacking these things to get accelerated, things, when our mental volition is all about solving a problem at scale and a social problem, the money part works itself out.
mm-hmm,
You don't think about commercializing. You think about how can we solve that person who's
mm-hmm,
on Alzheimer's and their family? How can we cure them?
mm-hmm,
Let's
mm-hmm,
worry about reverse engineering a business plan. And in a way, that's what we've done. And in a
mm-hmm,
way, that's what humanity needs to do. Like, we really need rapid prototyping of vaccines. We need rapid prototyping of, RNA testing. We really need to build this infrastructure. And we
mm-hmm.
need to come together. I just find it hard to believe that, like, hello, let's wake up. Like,
Yep.
we're all in the same boat here. And, I mean, it's like, there
I
isn't
hear you.
any.
I feel you. No, I mean, I think coming to this point of rapid prototyping and testing, and I'm doing a PhD at University of Ottawa. So one of the things I did was I took a lesson in health technology assessment. So that was my PhD major for my comprehensive. And the second thing I took was agile software development. And this is for me, so I'm one of those researchers who's looking at, okay, here's agile, and here is what is going to get you reimbursed, what's going to get regulated, and what's going to be like, okay, you can use it. And now a lot of the times, a lot of companies will take the consumer health approach, which is great, take it. But then even then, the consumer technologies have to talk at some point to each other as we go towards an IoT system, right? So the interoperability becomes an issue. So I think apart from the rapid testing that you mentioned, which is needed, what Health 4.0 is also looking at rapid policy development, because you cannot have regulations taking so much time to say, yes, we will reimburse, no, we won't reimburse, because technology is already at, well, like we're waiting for now 5G to be like, It's already there. They're doing 6G research. There's quantum computing happening, and we are still doing paper and sending snail mails for patients to get appointments. Like there's a huge from 1.0
Yeah.
to like 6.0 or 7.0. It's a huge gap.
Well, I think you touch some points here. So it's interesting. So I agree with you. And I think what happens is, look, systems take shape in all well-being and all, like good mental relations, like, healthcare, for example. You have a system, and it's like, let's help people, let's keep them healthy. But eventually what happens, these systems become so complex, and then the mission of helping people and curing people kind of gets a little bit distorted, and it becomes a bureaucratic system. And then at that point, the bureaucracy then is there to maintain itself and survive, right? So the shift kind of shifts around that. So when you talk about policy and existing systems, that is like, I think we could change that if we show the bureaucratic system that, hey, this is actually how we can save you money. Like literally, we could capture with brain mechanics, what we're doing. We're working on a deal with Calico, where we're actually capturing brain functional health for a tenth of a penny what it would cost them per data set, right? So who wouldn't want to have that, right? Or if you're talking about eradicating Alzheimer's for $20,000, who wouldn't want to have that when it costs them $350,000, right? So so I think we can't be also like idealists saying, we're going to change it. I think we could change it by actually show them the way path forward to say, here's some cost savings. Let's change the system around. Let's get a little bit faster. If you can show them the money, I think that's going to happen. The second thing that you mentioned is consumer electronics. I'm really passionate on our labs here in Calgary. We don't have the sophisticated equipment like they do in Colombia and other places. So we partner up with them, things like, shockwave therapy and all this kinds of big equipment, but our PMS systems. But what we do focus is on wearables. So we're really big on wearables, where things that, we feel like we could, either remotely monitor a patient or treat them remotely with different powerful therapies on bioenergetics and things like that. But we've also taken an approach where we said, you know what, let's say we do need a medical test. Let's say we do need an fMRI, right? But maybe instead of having, like this deal with Calico, they're wanting to actually do a cell therapy, and initially they wanted to do 2 MRIs, one before and one after. And it would cost them $3,500 per fMRI to do this, right? So it would be about $7,000. So I'm talking to Dr. Torres, our cell specialist, and I'm asking him, why are we only doing 2? And he said, well, it's $3,500 times 2 is $7,000, and we have 100 participants. That's $700,000. I said, I said, but in your world, is that good data? He's like, no, it's like an AM radio and resolution of data. And I said, okay, well, how about we do this? How about we actually build you an 8K TV? I said, what do you mean? It's like, well, how many data sets would it be to get the high resolution that you're needing to get, information on this therapy approach? He's like, well, ideally it'd be like 2 samples a week, but we can't do that. We're in Bogota, Colombia. These are people who have orphan neurological disorders, and they're not going to travel to a lab, even if we could afford it, right? So we said, okay. So we build them a solution where we actually are able to capture 2 data sets per week. And this is a 6-month study. So it's 48 different samples throughout the plus times 100 patients. So it'd be about $16.5 million worth of data. We could do it for $165,000, right? And not only that, he said, but you still have the problem with patients going to the clinic. It's like, okay, so we build them the equivalent of a satellite TV, so they don't even have to go anywhere. They can do the samples from home, right? That's what this type of technologies empower, right? And if you go to a medical field and you say, look, you're limited to $16.5 million or $165,000, that's when we change the system, when we have solutions that actually, now you're saying, okay, we want to do digital twin, but we need lots of data to feed big data of the body to run simulations, right? So we really have to break the bottleneck of the initial setup. Now, another approach that we take is we take the medical grade equipment, so maybe still do an fMRI, every so often, but then you actually take in, like you might use consumer electronics, and maybe an MRI would be a bad example because it's not, there's a consumer electronics, but, say for example, heart rate samples or EEGs or something like that, right? So you could still take a sample, on like maybe once every 3 months on a gold standard. But at the end of the day, like what you care about is trends. You care about, is this person's trend going up or down? What is it going? It's a compass, right? And what we've done in brain mechanics, we've actually calculated the variances between consumer electronic devices that are pretty good now, and then against a gold standard. And now with those variances, we really don't need the medical gear until later on if we want to actually keep that check, like a milestone per se. But you care about these 2-week sprints where we actually do an intervention and we check to see what their physiology and biology changes are. And within 2 weeks, not everything takes that short period of time to change. But anyway, measure 2 weeks, and then we then capture that, and then we're able to actually talk about, when people talk about personalized medicine and evidence-based, that's what we talk about in brain mechanics. We talk about actually like, okay, in theory, evidence says that if we do this, it would work for your biology, but we need to test it out for your biology, right? That might not work. So you might try something for 2 weeks, and for that person, it doesn't work. So then we need to then take that evidence and say, let's try something else, right? And 2 weeks, right? So that's where we're looking to innovate quite a bit on actually taking an agile approach, and really have this rapid prototyping. And eventually, I think this type of infrastructure of technology and this philosophy could then enable for us to start building these digital twins. Mm-hmm. Now you're talking about, we've captured this information for this person. Now let's use a simulation environment and run simulations to see what these things would actually happen.
Yeah. I mean, there are plenty of things that would need to go, and one side also have meaningful dashboards, avatars, and interactive elements, because this is all the back end. And the end, the customer and the consumer, firstly, nobody's ever seen their human body. Like today, the way we look or the way I understand my body is on a paper or a record or something. And as we start aggregating this, there will be so much needed to socially market this concept, to educate people about what health is. And that's sort of what this podcast is aiming. So Karim, you've mentioned your vision sort of is convergence, is a rapid prototyping, quick, reducing the time from research to kind of the actual usable product for a consumer. What do you think are the obstacles?
Well, I think that for us, we have to what we realize is that there are barriers. We're kind of like rebels doing all this stuff, right? At the end of the day, we need to interface with the traditional modern medicine, right? So right now we're looking to launch clinical trials from the Alzheimer's resolution. So it's going to be bona fide certified. Honestly, once it's validated, my mission in life, like I can die the next day and I would fulfill my purpose, but we're going to keep going. But it's interesting because every time you have an obstacle or a thing, it presents so many opportunities. So we realize too that, it takes time to have these things kind of fleshed out and be accepted by medicine, right? And there's also litigation, right? There's malpractice, there's other things, right? So we really need to be mindful of that. But what I saw is that I realized that we're not ready yet to launch that because of this friction. But what I saw is an opportunity. Mm-hmm. I saw that, and this protocol has 8 steps, and a few of the steps are related to optimizing the emotional level of the autonomic nervous system, and also, optimizing people's brain performance, right? Like Alzheimer's patients have prefrontal cortex or atrophied and things like that. So, and then sleep, right? So sleep is a big thing for Alzheimer's patients. And I'm talking to this doctors are saying, you know what, it's great we want to cure Alzheimer's, but let me tell you, there's a lot of people who have sleep is a huge problem. Emotional regulation is a huge problem. This is before the age of COVID, right? And even like brain functioning is a huge problem. I said, you know what, we should take this little 3 pieces, and maybe what we could do is there's a whole gray area here where, you have people who are healthy people, and then you have the disease, right? And there's a whole spectrum in the middle called a wellness space that is really not properly being addressed, right? So now what we've done is we started with a foundation. We realized that, instead of having to fundraise and try to get donations and all that stuff and hand me a fish, right? We realized, why don't we build a fishing rod here? Why don't we start a social enterprise called Brain Mechanics Corp, and we can go into the market with solutions to help people to, govern their emotions, but taking an evidence-based approach, like actually quantification to say, you know what, I'm going to show somebody that they're getting better by measuring the autonomic nervous system and the vagal tone, and this is our therapies work, right? I'm going to show somebody that they're going to get better by actually having a micronized PSG in their head to show them that, hey, every night you go to sleep is the equivalent of a sleep study, and you're getting better in your sleep, right? I want to do that on their brain functions, right? So now we spun this out, and now we're launching tomorrow at brainmechanics.io. We're launching this into the world, and we're making cost-effective solutions to make people, they're be able to reduce their stress, sleep better, and just perform better, right? And these things include neurofeedback, biofeedback. We've got wearables that have AI, things like for a ER patient or ER, not patient, ER worker, some of these people can't even tell their stress. So we got a wearable that measures their stress levels, and their stress, it vibrates, and when it vibrates, it's a great time for you to do your 4-7-8 breathing, or maybe a little box breathing, which is what they teach the Navy SEALs to regulate themselves, right? Or another, or psychophysiological coherence techniques, right? And if you're super stressed, we literally have wearables where you press 2 buttons and it hacks into your salient network to actually hack into your autonomic nervous system. And now we're hacking into it. And now within a matter of 3 minutes, you're completely regulated, right? Those are kind of the services that we're looking to bring into the world to really get in the front lines and start helping out. And we believe there's some statistics that 75 to 90% of all medical issues, they say, it's all related to stress, right?
Yes.
I don't know if that's that.
Yes.
I don't know how
physician, and yes.
Okay, so I don't know how valid that is, but let's say it's 50%. Even if it's still 50%, if we could actually start helping regulate, turning the tide on some of these stress issues, that stress and sleep and mental performance are all kind of the same thing, related to each other. And they're all really powerful epigenetic triggers, right? So if you're able to modulate your reaction to your environment and control your internal environment, like, look, we're like boats on an ocean. We can't control the winds, we can't control the waves, but we do have these beautiful sails that we can direct. And we do have this mast where we can actually, this wheel that we can turn our ships towards. And if we do that, then we become masters of our emotions and our reactions. And then that's going to help us to start turning the tide of all these different diseases, including some Alzheimer's, triggers of inflammation and things like that, and so many others. So that's what we feel like we're really building at Brain Mechanics, and we want to make it super affordable for people to actually get this quantified platform to help them deliver these multimodal therapies that are going to be just life-changing.
So Karim, we know the obstacles. What do you think is the motivation? What is the motivation to adopt this Brain Mechanics or Health 4.0? What is the motivation to adopt technology?
I think that people don't really care about technology. I think that what happens is they're going to care about results. So I think where we are different is we can actually, because I'm not a doctor, we have doctors and staff, but the whole idea is we want to show quantifiable results, right? So everything that we do at Brain Mechanics is quantifiable, right? Because we have to take just in an agile methodology approach, you do transparency, inspection, adaptation. So you have to make this patient's data transparent to a system. You have to inspect it every so often, and you have to adapt, right? So we believe that we're building a methodology or an approach that's coupled with technologies and therapies that we feel like we're going to be able to deliver the results. And I think people at the end of the day care about results, and they care about being approachable and affordable. Like, look, neurofeedback is wonderful, but at the end of the day, if it's going to cost me $200 to have my kid who's got ADHD, or somebody who's got an addiction, or somebody who's chronically depressed, to treat them per session, that's too much. Right? So we're coming up with ways where, like, literally about, $50-$60, you get unlimited neurofeedback a month, right? So it's like, you really have to look at it not to, and we're still going to be profitable, but you really need to look at it from a mental volition perspective, that your intent is to helping people at scale. So you can help just maybe 1,000 people, charging them $200 a month, or you can help hundreds of thousands of people by charging $50 or $60 a month. That's the difference, right? That's where we feel like, and we're a bunch of Vipassana meditators and heart math people. So, at the end of the day, it's like, as long as we solve that social problem, we're happy.
And coming to ethical behavior, it would also help the listeners understand how you take care of privacy and compliances. If you can shed some light on that too.
Yeah. So everything that we do is HIPAA and PIPA compliant. So all of our platforms are HIPAA and PIPA compliant. So, that's how we do things, and we try to implement that as well with our consumer electronics. So, so we're not inventing devices. We're constantly integrating. We're integrators, right? I'm constantly looking at I've got a wearable that hacks into autonomic nervous system. Version 1 is already out there. We're looking at version 2 and even version 3, right? And how is version 2 going to be cheaper and faster and better, right? So, and what we do is we integrate on the back end to this consumer electronics. So the consumer owns the data, but we need to take this data, we need to integrate it, and we are HIPAA and PIPA compliant. We are now taking on a project in about 6 months on actually building the back end infrastructure for a blockchain. So we are building a healthy chain, we call it. And the healthy chain, the whole vision there is that the patient, the person who we're helping, they're going to have complete control of their data, and they're going to be able to either, following a Dhamma philosophy, either donate it and get something, in return, because if you donate your data, you're now going to be able to run simulations around the world, make the world a better place. So you have power on your health data to help others. Isn't that wonderful, right?
Yeah, participation. Yeah.
And then so you could make it available for free, or you could then maybe, if it's a study on other participants or other researchers that need it, and it's a paid study, then they would actually be able to sell their data, right? But I think the patient should own the data. I think it's their data, and they have the power. And that's when you get into now harnessing that data to do digital twin initiatives, to then say, you know what, if you imagine a digital twin service where it's like, if you donate your data, we'll give you free digital twin services, wouldn't that be wonderful, right?
And those are the business models that will come out of this whole disruptive thinking. And this is exactly where Health 4.0 Summit is looking at, which is in June. And I know you're coming this year. So what do you think is going to be there for you at the summit? And can you tell me your expectations from the Health 4.0 Summit?
You know what? I just want to meet the rest of the tribe that's working on this. And I want to say, you know what, I'm going to open my heart and I'm going to give everything that I have to the tribe. And then whatever happens, happens. That's my expectation. I think that when you're working on changing things and trying to make the world a better place, sometimes, I feel like I'm a little hot coal in Calgary. I need to connect with another hot coal, maybe in Ottawa and in Colombia and Japan. But you know what? I'm not no longer a coal that's by itself. I've got about 8 coals, and now we've got a little bit of a fire going on. And if we can actually get some other coals that are out there that are getting cold and say, hey, join us, we can get this fire pit going, and we can change the world, literally.
Awesome. So as I speak to you today, I have this podcast in Japan, in India, US, Mexico, Brazil, Israel. And so we are around in 7-8 countries as of now. And so don't worry, we're going to create a global, positive fire of change, because this is exciting. So thank you, Karim, so much. And if you can once again tell about your website, that'll be helpful.
Yeah. So the not-for-profit is brainmechanics.org. Which is, you could see there's 18 projects that we love people to collaborate on. They're all going to be open source projects. And then brainmechanics.io is our social enterprise. So it is something that we're taking 20% of our profits now, and we're going to feed it into the R&D. And we've got just beautiful collaborations with different universities and different equipment manufacturers. Some folks are sending us equipment all the time. And we do have a platform where we can quantify things really cheap. So, we're open to collaborations. We love collaborations. We realize that these problems are big problems. And if you're ready to open your heart and join the cause, let's do it. You'll find a willing partner with us.
Awesome. And if you want to meet Karim and other such amazing people and innovators, please come to the Health 4 Summit, which is in June. And the website is www.health4.tech. Thank you so much. Thank you, Karim.
Wonderful. Thank you so much. Take care.